actually the Mountain View crew. Maybe that rhymed, but it rhymed. And we did our final semester project on preventing 30-day readmissions in congestive heart failure patients. We are Evan, Esma,
Leticia,
Lorena,
Sorry.
sorry,
Homer.
and Lorena. All right, so enjoy our presentation. Okay, this is just table of contents of what we're going to be going over. Okay.
and then as we formulated our project, we wanted to keep in mind the mission and vision of Mountain View Hospital, which is above all else, we are committed to the care and improvement of human life and to be the premier provider of exceptional care. So as our group spoke to leadership, we see that there's a lot of patients here admitted for congestive heart failure. And some things you guys already know about heart failure, but we wanted to tell you, is that heart failure affects about 5.7 million older Americans, and that will be trending upward as our population ages. 30-day readmissions is a huge barrier to effective disease management, and heart failure readmissions also make up about 25% again of readmissions. This is very costly to patients and facilities, roughly about $33 billion a year annually. And so our group wanted to brainstorm and come up with a way of reducing those 30-day admissions through simplified teaching sessions, and then just, you know, being able to really recognize those patients that need additional teaching and support.
Okay, so what's our project about? So our project seeks to answer why congestive heart failure patients are readmitted to the hospital so frequently and how we can decrease those numbers here in the Las Vegas community. We conducted research using evidence-based practice articles, and information was gathered to identify the most common findings linking to congestive heart failure patients to readmission. Our goal was to create a pamphlet to help Mountain View in remaining cost-effective while also discharging patients with an impactful education to better promote positive health outcomes.
And then we had to look up 5 different evidence-based practice articles, so that's what we're going to be reviewing is the research now.
So while researching for this project, I found a hospital study in which they implemented their own quality improvement project to reduce heart failure readmissions within that 30-day window. What they did is they found that about an hour of teaching is needed to be effective at educating their patients. All members of the healthcare team participated in this teaching. What this hospital did is they broke down the teaching sessions into 4 15-minute sessions, with each session focusing on a different aspect of disease management, whether that be medications or exercise, things of that nature. Follow-up calls were also performed during that 30-day window, and at the end of the study, this was found to reduce heart readmissions for these patients. As a group, and just being here on the floor, we would like to acknowledge that 15 minutes of bedside education can be very difficult to perform, and this is due to a number of factors. Patient readiness, patient being able to comprehend, and also their family dynamics. Do they have support, and what else is going on in their lives? And so we want to, that is how we're coming up with our teaching.
Okay, so I also found an article from Walden University also looking at research about the teach-back method. So patients were showing stellar readmission post discharge within the first 30 days. So what they did was they took a study into a hospital and told them that maybe we need to re-educate the nurses about the teach-back method so they see if they're doing it correctly. Maybe there's updates they're not aware of. What they suggested was a pre-test. You know how you have like monthly modules you have to do? Mm-hmm. They did that in their module stream, and they gave them a pre-test to see how they feel first. And then they did the module and did a post-test. So they can compare their, you know, what am I missing here? Am I doing this correctly? What can I do to change? And with this study, they predicted that the readmissions will be reduced by 30% if the nurses do imply the teach-back method and having the patient repeat the information in their own words, which can open up a lot of, for us, like we would know, are they understanding? Should I get help from family? It will give us a lot of idea how to help this patient not come back to the hospital. So this one was from Walden's University.
So I got this article from the Critical Care Nursing Journal. On this article, they found out that one intervention is not enough, so they incorporated the 3 R's. The 3 R's are review, reassess, and re-educate. The first step is review. You review the current plan and how the patient follows that plan, and or how well they follow that plan, while also assessing the risk factors onto why that plan hasn't worked before. The next step is to reassess the current plan with the patient and their families. During this step, it is important to identify the patient's identify what the patients lack in adequate family support and if they need further assistance for effective treatment. And then the last is the re-education portion. This portion, re-education, it needs to be done throughout the entire stay at the hospital, not just at discharge. Continuously educating them on diet, exercise, medications helps reinforce and promote self-management.
Okay, so I found this article through AHC Media, and what they looked at was consistency and an interdisciplinary approach. So according to this article, 1 in 4 people with CHF are readmitted to the hospital. It's a pretty big number. So organizations, care partners, Life Care Centers of America, and Assisted Home Health and Hospice came together to identify the existing gaps. Their common goal was to provide continuity of care across all 3 healthcare facilities to ensure an even distribution of simple and consistent education. This was accomplished through a few different ways. The first was using the same information, whether that was in the hospital or the skilled nursing facility. This proved to be less confusing for the patient and easier to remember. The patient was also supplied with a manual regarding CHF information and a checklist of how to properly care for the condition. Space inside the booklet was left for the healthcare provider to make comments, such as if the patient understood or not. If they didn't understand the information, they would make a note to reteach. During home health visits, the nurse would request access to the manual to see the healthcare provider's notes, wherein they would reteach all the difficult material, further reinforcing it. They also help to facilitate proper communication between facilities to form a reliable transitional team upon discharge. This allowed the patient to build an early rapport with these physicians and nurses and early on in treatment, and aided in keeping them stable upon discharge. During emergencies, the patient was taught to first contact the home health agency before admitting themselves to the emergency department, as many crises could be managed through the home health. Through development of this program, the heart failure readmission rate decreased by 50% in the skilled nursing facility at 3 settings in the pilot program alone.
So in this article that I found, this team had a goal to decrease 30-day readmissions for CHF. And we know that nurses have an excessive workload, which is a barrier to implementation sometimes. So this team decided to implement a few things. They hired additional full-time health professionals that focus on CHF patients only. They developed a bilingual patient education booklet or pamphlet. And they did follow-up care and obviously patient education. And with those implementations, they managed to decrease 30-day heart failure readmissions from 23.1% to 16.4%. So they managed to decrease their numbers by 6.7% in total.
Okay, so we did some research and then we contacted Mountain View. We contacted the hospital's cardiac services coordinator. We also spoke to one of the night nurses here, asked some questions what they think about what's going on with CHF patients post-discharge. And we also contacted the clinical professional development educator for information and resources that the facility uses. We took those information, looked at them, and we compared them with evidence-based practice. And we found that Mountain View's current practice and evidence-based practice are the same. So this is a really good thing to learn. We also determined that also you guys doing the teaching for these patients and educating them and giving them the resources, sometimes they're just overwhelmed. Sometimes they look at that packet that you give them and put it to the side because they're not about to read all of it, right? And we can't know how they really feel post-discharge. So the teach back method that I mentioned earlier really helps, because a lot of patients, when they talk to you like in their own words, they can tell you, hey, I'm not ready, I can't take care of myself, if you just open up that conversation. So to help with this, we created a pamphlet that we've been passing around to add to that packet that we give the patients, to see if that will help. Maybe if they look at the pamphlet, it has like the information they need, just like very summarized, plus some other information. Maybe that would help reduce readmissions within 30 days, because they are more likely to go to the pamphlet versus going through, you know, a whole packet. So Homer will talk more about the pamphlet.
And these are just some recommendations that we're just kind of seeing throughout all of these articles. I'm sure many of you already know about what to do, what not to do. So these are just some of the things we took into consideration when we created the pamphlet. You know, is the information accurate, consistent, up to date? Is it simple to read for this patient? Is it 6th grade reading level? Does it go through all the, you know, parts and pieces, the diet, examples of the diet, follow-up appointments, all that stuff? So Homer's going to talk about his awesome pamphlet.
All right, so we put this pamphlet together as a tool that you can hand out to the patients. It just consists of what heart failure is, diet recommendation, exercise recommendations with CHF, the local resources, and then that's basically all the stuff that was advised to put on there, like the rehab that's at Mountain View, because that's the ones that you guys use and are partnered with. The QR codes. This is definitely something that's very helpful for the patients, because all you have to do is just open up your camera, put it above the QR code, and it gives you videos and education on the heart failure, warning signs and symptoms, the diet recommendations, and then what ejection fraction is. On the back page, you could see that I also have common medications that are really often prescribed to CHF patients, and then on that side right there, it's a appointment tracker, just because I saw that on a lot of journals that I was finding was that a lot of patients don't really keep up with their doctor's appointments, so that's a good way to keep track. And then we also added a daily weight log, so to see that, you know, any weight gain or weight loss.
So, a little inclusion, sorry. I know you want to be done. Okay, so with congestive heart failure readmissions remaining high and hospitals are spending more money than necessary, even with the current efforts put into place by nurses, patient health is still deteriorating. So as a result of research, patient education is obviously pivotal in changing these numbers. Evidence-based practice shows using the teach-back method, using simple material, allowing adequate time for patient understanding is necessary in effective education. Also, using interdisciplinary team approach and family presence during these teaching sessions can also be very helpful. Mountain View follows many of these guidelines from these groups like American Heart Association and the Joint Commission already when performing these sessions, which obviously includes up-to-date information. However, this information, for whatever reason, is not sticking. So it's important to build an early rapport, engage patient motivation to learn before even stepping into the room. Many forget about the emotional toll this diagnosis has and how it affects one's mental health and willingness to keep up with their plan of care. Nurses must also manage their time effectively, because these patients do need more time than normally allotted at discharge to understand congestive heart failure. It is important to emphasize examples of what are acceptable foods on a cardiac diet and appropriate exercise techniques, not just exercise and diet. While in the room, remember the basics taught in nursing school. So use non-medical terms, speak slowly, use 6th grade reading level, reinforce the importance of follow-up appointments and implications of not doing so. Before leaving the room, reassess the patient's learning in order to see if it was indeed learned. If it wasn't, make notes to be made for outpatient facilities upon discharge. Letting the patient know that they are not alone when they leave that bed can be the difference between a trip to the Bahamas and a trip to the emergency department. Thank you.
Thank you.
Thank you.
Good job.